exciting webinar. Excuse me. So my name is Ash McCaskill. I am the programs coordinator of the Epic AT platform and at AgeWell. I am wearing a bright pink kind of sweater today, turtleneck, and I have short brown hair. I wear kind of cat eye glasses. I have green eyes. And I'm coming from Montreal today, and I encourage everyone in the chat to share, excuse me, where you are all coming from. So before I introduce today's amazing speaker, I just want to share a little bit of access points with you all, and also to promote an event that's actually happening right after this one. So please note that today's webinar is being recorded, and it will be available on the AgeWell YouTube channel after the event. I also do want to tell you that anyone that did register and is attending this event will also receive the recording and links to any resources that will be shared. You will also notice that there is closed captioning available. You'll see that just at the bottom of the of your Zoom window. So if you do see that, you'll see kind of like two CCs. It will click, if you click that, basically an automized text will show up that will show what we are saying today. I still always say that sometimes there will still be some inaccuracies, so just be forewarned if it's not perfect. Also, just to make sure that everyone has a really great experience today, we just ask that everyone show respect and kindness in this space. So any form of harassment, someone will be removed if they do show any type of form of aggressiveness or harassment. So yes, please be kind. There will be a Q&A at the end. However, I will allow our speaker to also share that maybe there'll be questions that'll be allowed throughout. So I'll let Simon explain more about that, which is always really great. If you do have a question though, please know that you can choose the Q&A box, which is just at the bottom. You can leave your question and we'll be happy to share that and answer it. And also we encourage you to use the chat. Please know that I will be moderating that chat today, and you can always, if there's any technical thing that's happening, please message me. Yes, and so before I introduce our amazing speaker, I do just want to share that we also are having an event right after this. It is actually a Twitter Q&A that's going to be hosted on the AgeWell Twitter, which will be featuring, moderated by our own Ali Fournier, who is our digital media specialist. So if you are interested on that, it will be on asking questions on healthy aging. So yes, I will share some more about that in the chat. So I do encourage you to all come. So let me introduce our amazing speaker today. So again, today's webinar is called Canada's Digital Health Journey, and I'm excited to introduce Simon Higgins. Simon is the Senior Director of Performance Analytics at Canada's Health Infoway. His team trends, forms, and communicates the evolution of digital health in Canada. This work involves collaboration with the research community, overseeing a program of survey research, monitoring project performance, and intelligence gathering. Simon just completed a term as board chair at Four Villages Community Health Centre in West Toronto, leading the organization through a merger with two other community health service providers. In prior roles, Simon has been a manager in a primary care and community health organization and a market researcher in the pharmaceutical industry. Simon holds a bachelor's in science from the University of Guelph. Oh, I did my postdoc there too. And an MBA at McGill. I also am in Montreal. So Simon, this is already off to a great start. So please everyone, give a great and warm welcome if you can to our exciting webinar and speaker today, Simon Higgins. Thank you so much.
Awesome. Thanks very much, Ash. Really, really appreciate that introduction. And it's great to be here and great to be with this group. I've got a series of slides and materials to share with you today. But as Ash alluded to, I'm very happy to make this a conversation. So if there are questions that pop up throughout the discussions, by all means, jump in, interrupt me, or put them in the Q&A, and we can try and take the conversation into places that are of interest to you. I was asking Ash a little bit about the kind of folks that generally attend, to try and make sure that I can tailor the comments. It sounds like the majority of you are in the health space, likely in the digital health space. So I might cover topics you're already familiar with, and I'm happy to dive into whatever topics you wanna go and look at. So 4 things that I was planning on covering today: a little bit about who we are as an organization and the work that we've been doing over the last 20 years or so, and then diving into some of the really important topics that are on our plate these days: interoperability, digital health equity, and Prescribit, the National Electronic Prescribing Service. So before I dive into about Infoway, I'll try and get a touch interactive here. Some of you might be familiar with us. Some of you might be very familiar. Some of you might have never heard of us. And if you're familiar with Infoway, do you want to just give me a little thumbs up or a little wave, some kind of an indication, and I'll try and tailor the depth of my Infoway description to make sure that that I catch people up and have a level bar for people. So if you're familiar with Infoway, try giving me a thumbs up. And now I'm wondering, can I see those thumbs up? Maybe not. All right. So I will just jump in, and I will give the medium level description, but by all means ask questions if you want more. So this is kind of a visual representation of the journey that Infoway has been on and been part of with our provincial and territorial partners for the last 20 years. So Infoway is a federally funded not-for-profit organization. We're what's known as a pan-Canadian health organization. So like organizations like CIHI and the Mental Health Commission, we have a national role, substantially funded by the federal government. Our governance structure is such that our members are the deputy ministers of health of the provinces, territories, and federal government. So we are owned by the health systems in the country. They provide our direction, and we really try and play that role of meeting the needs of all of those stakeholders and addressing areas of common interest. The way our funding works is that Health Canada will provide us funding for specific mandates, and those are mandates where you have that broad consensus, where the provinces and territories recognize their issues, want to move forward. There's an opportunity to do something at a national scale that offers advantages over each province and territory going on their own. And in those situations, Health Canada will structure for us a mandate with some very specific technologies, very specific objectives. And these mandates tend to be sort of in the roughly kind of 5-year range. And are really about substantially advancing one portion of technology over that time period. This illustration here is kind of a visual of the major mandates that Infoway has had over the years. And it kind of roughly tracks to the story of how digital health has been evolving in Canada for the last 20 years. So if you can think back to early 2000s, Infoway created in 2001, the situation in healthcare. What you would have found at that point in time was it was a substantially paper-based world. There were some solutions in pockets, but despite the fact that the internet bubble had come and gone, healthcare remained quite paper-based. And so the initial mandates that Infoway had was substantially about digitizing core elements of personal health information and trying to make that more broadly available. So think about lab results, think about diagnostic images moving from film over to digital imaging, medication registries, think about building provider and client registries so that we're able to understand patients and providers and communicate between them. So a lot of it was about building that infrastructure and building a vision for how health information would evolve in Canada. So that was a significant portion of the first number of years. And that work, of course, evolved, and I'll make reference to how it is part of the work we're doing today. Next big phase of work was around digitization of health records at the point of care. So back in 2006, we had about a quarter of physicians that were using electronic records in their practices. Vast majority were in paper-based worlds. And so a significant effort on the part of provinces and territories to help physicians transition to electronic worlds. And as I'll show you a little bit later in the presentation, we're at a point now that about 9 in 10 clinicians are operating in a digital environment. So a really massive change over the last 15 or 20 years in healthcare. So that was the next big phase. More recently, then, we've done a lot of work in the space of providing access to care for patients. So recognizing that patients are really part of this digital revolution in health, and that patients are interested in a wide variety of digital health services, accessing their information, booking appointments, and a variety of these kinds of services. And so lots of effort went into building strategies and supporting provinces and territories to roll those out. Of course, the pandemic had a profound impact on citizen interest and use of digital health, and so that became a really important touch point for the virtualization of care and for digital health for citizens. Now, one important thing about this notion of patient access to care and services is that we were lucky in Canada to have had a solid foundation of this work. So back in the days when we were building infrastructure, we were also investing in early telehealth, remote monitoring, and similar kinds of programs. So the work around providing patients better access is really a continuation of work that began a long time ago. And then as this work has evolved, the new work that InfoWay is embarking on is really all about connectivity. It's about connecting clinicians to each other so that they can share more effectively, more easily, connecting patients to their information into services, and prescribing being a really important part of that. So that's the general journey that InfoWay has been on, and it kind of maps to the journey that the country's been on as well. I'm just checking the notes. Oh, sorry. Okay. I don't think there's a question in there, but I will keep on checking the chat to see if there's questions that pop up. So that's the story of InfoWay. I'm really happy to dive into more stories of our organization and various aspects of it. But I will now dive into some of the details of the kind of stuff that we are working on. So interoperability, and if it was working for people to raise hands and things like that, I would love to get a sense of your sort of base level of knowledge on this topic. Interoperability is a word that causes our communications department lots of concern, but it's a word that is really starting to stick, and that it's used by our funders at Health Canada. It's used by our counterparts in the provinces and territories, and it really is about communication between systems. So it's about one system being able to send a message that can be interpreted by the system across the street. And that's a critical thing with health information, when security and accuracy of that information is important. So that's what we're talking about when we mean interoperability. And hopefully by the end of this presentation, if you weren't familiar with that word before, you'll know a little bit more about it. These are the objectives, the strategic goals that we have at InfoWay around interoperability. And so I'll share a little bit of, spend a little bit more time on this. Really important to note that these goals are very much goals, not just of InfoWay, but also of the provinces and territories and of the federal government. And for those of you who might have noted the federal budget a few days ago, you would have seen a reference to this work in that federal budget and funding going to ourselves, CIHI and other data partners to advance this work. So this is a bit of a deep dive into what our pieces of that work are. So on the interoperability front, we're trying to do 4 things. First thing is we're trying to do is reduce data blocking and ease data portability. So that means unlocking data that's captured in systems. And so you might have noted when I talked about some of the early work at InfoWay, we did a lot of that work with things like lab information, diagnostic images, medications, which now flow more easily than they used to. But incredible amount of data is tied up in those primary care record systems, in those hospital systems with really important patient data that doesn't flow very easily. And so a lot of this is about legislative change, policy change to make sure we can share data. And a huge portion of it is about standards. It's about making sure that terminology standards are aligned, and it's making sure that messaging standards enable that sharing of information back and forth. So that's the data portability piece. The second big goal is around ensuring that providers have better access to that data. So I noted that the first part of our mandate was about digitizing and making that information available. What we see today is that information is largely available, but it's not very well suited to workflows of clinicians. There's often multiple systems, there's logins, there's viewers that they might need to go to, and that data, they might be looking at lab results from different settings, and those lab results might be in different formats, might have different characterizations of the information. And so we have this challenge that providers don't have a common view of patient information from across settings. So the second goal is really about solving that problem. And then really importantly, allowing those providers to contribute standardized data to that patient record. Third goal is about enabling patient access to their own information. This is about ensuring that patients can see their longitudinal health information. So understanding what settings they visited over time, lab results, medications, various other pieces of information that help them trend that journey and really empower them to understand their care. And as I'll talk about in a few minutes, there's a whole lot of spin-off benefits that come from that level of patient access. And then the fourth one is around coordination of care. And so this really builds on the first three. And I'm sure many of you would be familiar with something like a referral process and can picture that. Many of us have had referral processes as an example that have gone wrong, and you can imagine that piece of, what relatively simple process of your GP looking for a specialist for you to see involves a significant back and forth of information and involves really challenging questions about, is this the right service for this patient? Does that specialist or that service have room for that patient? Does that specialist have all the information they need about that care? And this is where we see a massive opportunity for digital health. And as you can see, those first three objectives are met. You open up a huge opportunity for better coordination of care, things like e-referral, things like electronic consults, and of course, electronic prescribing is one of those really high volume care coordination activities that happens. So that's the goals around interoperability. Now, this is, as I mentioned, I'm leading a team called Performance Analytics. So at Infoway, I'm known as the data guy, and as a consequence, you're getting a data-heavy presentation, which I hope you'll enjoy. And we try to make sure at Infoway that our strategies and our efforts are substantially data-based. And so when we were starting to plan for the interoperability work, we conducted this interoperability study where we went out and spoke to clinicians, patients, a wide variety of stakeholders to try and make sure we really understood the problem deeply. When we talk to clinicians, what we see is massive challenges that show up on their doorsteps from this disjointed electronic world that we're in. So you have a significant portion that are still receiving information through fax and paper. You have the large majority that say that they are not always informed about care that their patient has received in other settings. You're seeing that clinicians are wasting a significant portion of time. So clinicians reported wasting about 40 minutes per day looking for patient information from other settings. So we're talking about really material challenges that are emerging from this disjointed information. And we also see that clinicians see a significant opportunity for improved value, which is a really important thing. Whenever you're trying to address challenges in the healthcare system, if you are addressing challenges that are on the forefront of clinicians' minds, it is a much easier thing to tackle. Into some other details that emerged from this study. The state of environments now being digital was one of the really important ones, and this was not a shocking finding for us. We've been trending this change over time since, as I mentioned, in the early 2000s, as we started looking at the state of digitization and recognized that we had a largely paper environment out there. Getting record keeping at the point of care into electronic systems has been a major priority. And as you can see, we're at a point that 9 in 10 clinicians are saying that, yeah, they in fact are practicing with electronic records, and that's even higher for GPs and specialists. On the right-hand side, what you can see is that for a number of these folks, hybrid systems are still a reality. So there are a mix of systems that they may have in their practice. The nice thing is that the dark red bar, which is charting in just a single system, that bar has grown substantially over the last decade. And so that's really nice to see, because we know that when there are multiple systems involved in your charting and in your day, that brings with it a whole lot of risk and time waste and a variety of issues. So the big thing that I think was really important out of this study overall was that there is a shared vision for connected care and a shared vision for interoperability. So if you talk to clinicians, you talk to patients, you talk to health system administrators, everybody recognizes the problem, everybody sees the importance of solving it. They recognize it's a gigantic and really challenging problem to solve, but there is a common purpose, common interest, and that is an incredible starting point for the. So I'm going to pivot now and talk a little bit about the patient access side and patient use of services. And this is data from our annual tracking survey of Canadians, our Canadian Digital Health Survey. So annually we go out and ask Canadians about their experiences with digital health, their interest in digital health, their perceptions of digital health, and we get a variety of information. I'm going to dive into a bunch of that data with you here today. This is one of the most sort of important overall top-level views, and this is a sense of what services Canadians are interested in, which is those blue bars you see, and which services they have ever actually used, which is that pink bar that you see. And so what you can take away from this graph is that the vast majority of Canadians are interested in receiving care through digital health services. 94% interested in at least one of these. When you're talking about something like having your prescription sent directly to a pharmacy, or accessing your personal health information, receiving reminders, prescription renewals, you're seeing 8 in 10 Canadians that have a strong interest in those kinds of services, and even services that you might think would be of interest to a smaller portion of the population, like mental health services or remote monitoring, of interest to significant portions of the population. So we see really substantial demand for digital health services. And when you look down the pink bars, what you see is some really important gaps emerging there. Now, what's really important in the trend lines is that we see that these pink bars have grown dramatically over the last 5 years, over the last 10 years. Many of these have doubled in the last 5 years. A lot of that driven by the pandemic and increased interest in virtualization of care, but the increasing availability of these digital services from provinces and territories is certainly driving these numbers up. So very important graph, and I'm gonna dive into some other points of it as we go on a little bit further. This is a bit of a breakdown of the specific one around patient access to their own health information. Have you actually ever accessed your own health information electronically? And what we can see here is that 36% said, yep, I've done that. And when we break that down across different demographics, you see really significant variation. So there are provinces out there that have really quite advanced solutions to provide patients access to their own health information. Alberta and Saskatchewan really leading examples with some great solutions that provide information from across the spectrum of care. Quebec also with an excellent longstanding solution in this place. Other provinces where there's less functionality available. So we see variation, which is very important for us strategically to think about where we go from here. We also see variation based upon various demographics. And I'm going to dive into that a little bit later when we talk about equity, but what you can see, no surprise, is that there are people with chronic conditions, for example, more likely to have access to their information. As you'll note, seniors more likely to have access to their own health information. So those demographic breakdowns become very important as we dive into trying how to address these challenges, try to figure out how to accelerate use of these solutions. Let's check the chat again. So yeah, question about whether Quebec is included in these stats. Absolutely. Yep. Quebec is included. And I'll pull up the website where we present a bunch of this data in a little while, and I'll give you a sense of how you can actually look at some of those province-specific breakdowns. And really appreciate the comment that you love data. We got data, so we can have an ongoing conversation on some of these topics. This next slide speaks to perceptions of those Canadians, so that 36% of Canadians that said they had access to their information online. And what we see in those perceptions is really strong positive value that Canadians are experiencing. They're feeling more in control of their care, more informed about their care. But really importantly, when you get to the bottom, many Canadians are noting that they are able to avoid unnecessary visits and unnecessary encounters with the healthcare system because they're able to access that. So when you start to get to those kinds of topics, you're getting to real material value for Canadians and for the healthcare system. So this is really important data because it helps us to build the business case and explain to various stakeholders why things like patient access to information is so important. So this is the last line in the section that's about interoperability, and as I note, that interoperability, of course, has all of those four objectives associated with it. When we step back and look at the value of achieving those things, what we see is really substantive value, massive opportunity for health system efficiencies. And we think about all of those care coordination issues that turn into a repeated test, an extra couple of hours in an emergency department, an overnight stay in a hospital because you couldn't be discharged. Those kinds of things add up to significant value. We think about all that patient time that is wasted when people have to redo a visit, when a piece of information hasn't flowed, or when there's been a delay in care, and that has really important implications for patients. And finally, for clinicians, you know, all of that time spent wasted looking for information, all of the care that could have been provided quickly and virtually, but instead required an in-person visit, generates significant opportunities for improvements there. So for us, these numbers are important projections that help us demonstrate to our stakeholders that these are material problems we're trying to address, and it is worth everybody's time and effort to get these things right, because they will make our system more efficient in a way that really matters. All right, so I'm moving now over to the topic of digital health equity for a few moments. So equity became a really important, I mean, it's always been a topic that's been on our mind and an area that we've done analysis, but became a really important topic during the pandemic. So something that was a really important finding, no surprise, as in April 2020, we had a scenario where the vast majority of healthcare in this country moved virtual. Doctors' offices' doors were locked in many cases. And so we had a rapid virtualization of care. And we in Canada were actually in not a bad position for that, having electronic medical records in most offices, having virtual care solutions that had been tried out in many provinces and territories, a reasonable experience with telehealth and virtual care, and the ability to deploy quickly some technologies like Zoom that we're working on today that could fill a stopgap. And so that all went in many ways quite well, considering how it could have gone if we'd had a pandemic 10 years earlier. But one of the things that really emerged from this was equity issues, right? And I think this is one of the really important findings of the pandemic that we should have been looking at more closely beforehand. That different demographics will receive care differently, and different kinds of interventions are better for different kinds of demographics. And so understanding what works for who and how we make sure that those kinds of solutions are broadly available and serve people as best they can is an important part of the work. So what we've done in this analysis is we take that data that I was sharing with you earlier from our citizen survey, asking people about their interests, asking people about the services that they have been able to access, and we start breaking it down and looking at some of those differences. So my colleagues Waldo Boziger, who leads all of this equity analysis work, and what he's done in this analysis is generate a bundle of digital health services that people have access And he's broken that out into different demographics. So if you have a regular healthcare provider, as an example, you are more likely to have access to digital health service than if you don't. If you've got a chronic condition, you are more likely to have access to digital health service than if you don't. And so there are, of course, many factors that drive it. So people with chronic conditions more likely to need healthcare services. So these aren't perfect or discrete numbers, but what they do is they give us a window into where those solutions are really getting traction on the ground and where they're not. When we look at these across a couple of different demographics, we continue to see different kinds of variation. So age is going to be of interest to this group. And in fact, what we see is millennials slightly more likely to have used a digital health service than older adults. But the difference here, and where the important nuances come in, is that these audiences are often looking at different kinds of digital health services. So you have noted when I spoke about citizen access to their own information, older adults more likely than millennials to have viewed their information online. Older adults more likely than millennials to have had a telephone visit. Millennials, on the other hand, more likely to have had a video visit, more likely to have accessed an online mental health tool. So we can start to see some of these differences and disparities pop up. Geographic location, a really important one. Rural Canadians less likely to have accessed a digital health service than Canadians living in urban centers. When we look at breakdowns around ethnicity, we start to see some variances breakdown, and the same thing with language. Important variances that we need to understand when we're driving forward strategies to deploy these kinds of solutions. And then finally, income. And no surprise, income is a huge differentiator in a wide variety of healthcare experiences, and no surprise that you would see that kind of a differentiator here. I'm gonna stop for a second and switch over. I want to share with you a website that we offer called our InfoWay Insights website. So bear with me for just a second while I get that pulled up. So the website should be up. If you're having a tough time seeing that or it's not showing up, okay, I think it's sharing. Great. So this is InfoWay Insights. This is the place that we put all of that survey data. And so if you scroll down on this page, what you can see is here's the survey of citizens. This is the 2021 survey that's up now. The 2022 data that I just shared with you, that will be live in actually just a few days. But on this Insights website, we also have data from our National Physician Survey, our National Survey of Pharmacists, our privacy survey, and some COVID-specific analysis that we did. So a real trove of data. But the thing that I want to let all of you know about in here is the ability to slice and dice. So these are fairly large sample surveys. That this Canadian Digital Health Survey, a sample of about 12,000 people. And so it gives us the opportunity to dive into different demographics. So this is a slightly different set of the data that I shared earlier, but this is interest in use of virtual video visits. So and you can see, interestingly, this grew, not surprisingly, 2019 to 2020, big jump in people that are interested in virtual video visits, and a big jump in people who had actually received a virtual video visit. Now, some of you are going to be interested, I would imagine many of you are going to be interested in some of the age breakdowns. We can filter by age and see how those numbers differ by age. And what you can see in the video visits is same general pattern of a substantive jump in 2020, but the numbers are lower than they are for the overall population. And you'll see down here at the sample size at the bottom. So over 2,000 respondents that were over 65 in this set. So lots of data to be able to do analysis with. And provincial territorial breakdowns also available. So as an example, we had a question about Quebec. This specifically relates to seniors in Quebec. So I've filtered for people over 65, and I filtered for Quebec. You've got a sample of 436 Canadians and or Quebecers, and then you can see similar patterns, but important nuances and variation. So I wanted to make that site available to you, make sure it was something you're aware of, and certainly encourage you to go and use it. I'll also note that for those of you that want to be able to dive into the data in more substantive way, we also make that data available through something called the Dataverse. And if you search for InfoWay Dataverse, you'll be able to find it. There's also a link at the end of the presentation. And on the Dataverse, what we do is make available full data sets with the data dictionary and the questionnaire and all those things. So if you want to be able to dive in and do more substantive analysis, then that's the place for you to go. All right, so I'm going to go back to my presentation and share again. Apologies for the flipping around. There we go. All right, I'll just check the chat. There we go. Okay. Good. So that's the equity story, and just so you can get a sense of how this data gets used, the federal government, very interested in health equity, has a table that's specific to virtual care equity. We try and make sure that we make this data available to that table and give them the slices and dices that will be of interest to them. As our programs are rolling out, we try to make sure that those teams are well aware of this data, because as you can note, for things like urban versus rural, huge opportunities for rural Canadians to use digital care services as a way to avoid unnecessary travel. Huge opportunities to do things for different socioeconomic groups or for different ethnicity, language groups to make sure that access and use of those services can catch up to some of their peers. So huge opportunities in this work to tactically improve the way we do equipment technology, but really importantly, change management, awareness building, and all these kinds of things. So then the last thing I'll spend a bit of time on is Prescribe It. Prescribe It we kind of describe as connected care in action. Prescribe It is a solution that we began work on over 5 years ago now. Electronic prescribing was identified as one of those topics that would benefit from a national approach. And while InfoWay in most cases works as a strategic investor and a partner funding digital health solutions, in this case, it made sense for us to build a service. And I'll give you a little bit more background on why that made sense. So what is e-prescribing? It is the secure electronic creation and transmission of a prescription between a prescriber and a pharmacy. So what seems like a very simple activity, simply capturing the prescription in the point of service system, in the EMR, and sending it directly into the point of service system at the other end. A surprisingly complex process overall, but basically it is as simple as making sure that the right information gets captured and that shows up, and it does not allow for things like transcription errors. The introduction of standards means that we try and make sure that those prescriptions are all complete. And of course, legibility is addressed through that process. Really important part is this last piece about integrating into clinical workflow. And I'm sure many of you would recognize when you've been in pharmacies that you often see activity behind the counter where there's lots of phone calls, there's faxes coming in. And what we recognize is that those phone calls and those faxes are both a drag on productivity, but also an opportunity to introduce errors into the process. And so part of the Prescribe It solution is also building in that clinical communication, ability to do renewals, and some of that functionality that allows that medication management to happen within one system and resolve those kinds of challenges rather than having to involve phones and faxes and other things that are open to generating errors. So when we step back and look at the value proposition for e-prescribing, quite significant. So for patients, obviously, medication safety is a very important thing, but so is their time, and so is their ability to pick up their prescriptions as quickly as possible, to know that their prescription has arrived somewhere, and so this provides some significant benefits for patients. For pharmacists and prescribers, I've talked a lot about the workflows. That's the really important thing for them from a business perspective. And a huge part of what the Prescribit team does on a daily basis is look at and try to understand the integration of Prescribit with their point of service systems and how that has implications for their workflow. Of course, pharmacists and prescribers are heavily invested in quality of care, and so they see significant quality of care benefits and are really excited about those benefits as well. And then at the health system level, significant value when it comes to things like medication safety. So we've talked about even the basic things like avoiding handwriting errors, avoiding transcription errors, avoiding communication and callback confusion, improves medication safety, and there's lots of opportunities to further improve medication safety with better e-prescribing data. So the same thing goes for medication adherence, huge opportunities to improve medication adherence. And then as it relates to the topic of narcotics and opioids, we see, again, some immediate benefits in terms of secure transmission and fraud reduction, but also significant opportunities down the road as there is more and better data available to support decision-making and management of the opioid crisis. So this is kind of where we're at today with Prescribit. Prescribit is live in 7 jurisdictions, and the other jurisdictions, the remaining jurisdictions in the country have memorandum of understanding, and we're working towards making the solution live there. So a gradual, slow burn, which is the way that digital health does tend to unfold in this country. The right-hand graph is a graph of enrollments and go-lives for prescribers. And we have a similar strong uptake with pharmacies. We're getting to really material portions of the clinical population now. And as you can see, this just takes time to grow and grow. And we will ideally get to the vast majority of prescribers in the country sending prescriptions through Prescribit. The last point I want to make around Prescribit is the sort of rationale for a national solution. And I think one of the really important things about Infoway's work and our collaboration with our federal, provincial, and territorial governments is finding the sweet spot where there are problems that are best addressed at a national level. And there are absolutely important topics for care, which are local topics and which require local customization. But when we look at things like electronic prescribing, one of the key challenges is that integration with solutions, right? It's, you've got across the country, you've got about 30, maybe even 40 EMR vendors that have reasonable market share. You've got 4 or 5 major pharmacy systems that have market share across the country. For any given province to deal with all of that integration, it just doesn't make sense. What makes sense is at the national level to try and do that integration once. And so Prescribit is a perfect example of a service that makes sense to offer at a national level because it offers these kind of opportunities for efficiencies and scale that are harder for individual provinces to achieve. Recognizing, of course, that each province and territory has their own rules and regulations that relate to prescribing. And so we do a lot of important work on the ground to make sure that Prescribit fits into the digital health strategies of each province and territory. So I just wanted to highlight that as kind of the last point, because in the digital health space, we recognize that health systems are, of course, provincially and territorially managed. And what we are looking for nationally is opportunities that we can deliver solutions or add value to topics where a national perspective or a national approach will be more effective than everybody going it alone and trying to solve the problems themselves. So that's the story. I'll leave you with a couple of links if you want to explore more of our data or learn a bit more about us. We've got an evaluation network. So if you're into the data, by all means, sign up for the evaluation network. I hope some of you will go and explore our Insights website. There's a ton of data there. We've got a newsletter you can sign up to and lots of reports to look at. So I will stop sharing now. And I am very open to whatever questions, comments, or discussion might be of interest to the group.
Thank you so much, Simon. That was so interesting and so many resources to share after this webinar. that I'm excited to share with our network when we share this webinar. And just a lot of ways of how we can think about how to do research and how much data, like you said, has such an important impact on how we can create those adoptions of digital health solutions. So thank you for that. I do want to open the floor, so I will ask everyone, any participants that have questions. I know I have lots because I'm so interested. If anyone has any questions or comments, please use the, you can use the Q&A option, or you can share in the chat. You can also raise your hand in the participant kind of options. And we can invite you to come to the mic, but just remember, please, that this is a recorded webinar. So as we wait for maybe people to compile their questions, yeah, I have just so much to think about and to take in. I guess I was really wondering, like, when we think about those Canadians, that small amount that you say shared in your data that were less inclined to maybe use digital health as a means to access their healthcare. What are some of the challenges with it kind of showing them the ways that these solutions will be really helpful to them? And what were some of the reasons that you found in the data that, if that was shared, why there was a bit of a hesitancy to kind of adopt digital health practices in their own day-to-day lives?
Mm-hmm. Yeah, great question. So the data sets I shared will have some insights there. The privacy survey, which is also up on Insights, has some very important evidence in there as well. But just to give you a sense of the general themes, so there are certainly a portion of Canadians who are less comfortable with digital tools in general, which is no surprise at all. And so for those folks, an in-person visit is a preference over a virtual visit of some kind. There are absolutely folks out there that are really concerned about the privacy and security aspects of these solutions. And so for those folks, what we try to do is make sure that, well, number one, privacy and security is absolutely central to all of our work. And then number two, making sure that that's transparent, making sure it's clear to people that they understand the privacy and security precautions that have been taken. So I think those are probably the largest ones, like you sort of just digital hesitance and then privacy and security will be the biggest ones that come up. But I think the other really important thing is awareness. So, you know, when we look at awareness of the tools that are available, the vast majority of Canadians aren't available, aren't aware of the rich resources that are out there and available to them. So I think communication about that is really critical. Maybe I guess the last thing just to mention is that one thing that kind of happened in the pandemic was people had the sense that, okay, now care is going to be delivered virtually, and that's just the way it is. And I think the really important message is, no, that's not the way it is. That people need to be able to access care through the channel that makes the most sense for their personal situation and for their condition. And they need to be able to work with their care provider to find that right channel. And so in some cases, a digital channel makes really good sense. If you're trying to renew a prescription that you've been taking for years and you don't need to have a conversation about it, doing that electronically is great. If you have a new health concern that needs investigation, an in-person visit might be most important for that. And so recognizing that there are many different situations where virtual can be applied, and that we need to, as health systems, get better at helping patients and clinicians understand what tool fits with what scenario.
Thank you so much. It's so enlightening. To learn about how to navigate those very challenging kind of areas. We do have a question from Ivan. Ivan asks, to what extent is a lack or rural remote telecom infrastructure contributing to lack of access? Our incumbent telecom providers have not taken rural connectivity seriously.
Yes, I would completely agree with that, and it's absolutely an issue. And as you know, it is the rural and the remote, and specifically the remote the remote communities where that is the biggest challenge. And I know certainly in InfoWay's earlier years, there was a lot of investment in telehealth, especially for Indigenous communities. And it still lags dramatically. So it is absolutely a barrier. I think it is something that is recognized by our partners in the federal government and the provincial governments. But without the infrastructure, you can't deliver the services. And so it's something that we continue to advocate for. And you know, our hope is that investment just continues in this space. Hopefully, numbers like this that sort of demonstrate the value of people living in remote areas having access to virtual care. Hopefully that data helps build that case to say, hey, we shouldn't just think of this as a nice to have. This isn't about having faster Netflix. This is about avoiding having to fly to a city to do a follow-up visit for something when you could do it from the comfort of your home. And hopefully those kinds of evidence points make that case.
Thank you so much, Simon. I guess as we wait for our next question, I guess one of the other things that you talked about was sometimes the time that it takes to gather this data and to adopt and to create like a digital health solution, like with e-prescribing, I think is what you shared. Can you share a little bit about maybe with that specific project, what was that timeline like? Like how long did it take in terms of the survey kind of collecting data, and then to really launch that project? What type of timeline can you share so that maybe that others that are just entering this process can create like expectations and understand how to have a better understanding of some of those timelines?
Yeah, no, I love that question, because I think one of the things that we regularly run into in the digital health space is this assumption that we can drive out change really quickly. And the reality is, in all aspects of healthcare, transformation takes a long time. And so the Prescribe It is a great view of that journey. So 2015, 2016, 2017 were years that we were working on building the business case, building support for the concept of Prescribe It. You know, the provinces and territories had been working towards their own electronic prescribing solutions, running into challenges. Working with our funders to say, you know what, this is an important solution. Then moving into solution design and building a solution that meets the needs of clinicians, of patients, but also of regulators, of pharmacies. You know, so many stakeholders to get on board. And then, as you can see from that uptake chart, we're a good 4 years into adoption, and it is this gradual process of moving across the country. And for many folks, these kind of timelines are frustrating, and they're frustrating for us as well. But I think the reality is, what we need to do is take a long-term view to these things. Recognize, and I think about sort of the digitization of record keeping. You know, we're talking about 2006, we were at a quarter, now we're at 90%. And that is 17 years later. So these things do take a long time to get them right. And as a consequence, we need to do really purposeful planning and plan for the long term, because we really don't see things in healthcare that change overnight. And so we need purposeful planning and long-term commitments.
Thank you so much. I do encourage everyone to use the chat. We do have another few minutes. So if anyone does have any questions, I do want to say, Ivan, I did share in the chat. They shared, thank you for your advocacy. So thank you, Simon, for your advocacy. I maybe just going back to that archiving of digital, of like health records, of health information. For you, what has been, like, just based on this data, what has been the most challenging aspect of, like you said, just beyond just the time of it, what's been the most challenging aspect of making sure that there is this transitioning to fully having digitized archives, so that, I know you said at the beginning of your presentation that we don't have clinicians spending 40 minutes out of maybe like a 8-hour shift and maybe a family clinician, a family office looking for that information, when they could be creating like those kind of one-on-one relationships with their patients. I mean, 40 minutes is a very big time. So what is that? What is the biggest challenge we have right now as a country to get to that place of adopting some of those archives?
Yeah, great question, and there's a variety of them, but I think what I might suggest would be a focus area would be thinking right back into the delivery of clinical care and charting, and if I think about some of the challenges that are in the minds of our federal government, of our provincial governments, a lot of them get back to the root of health information as it is captured by physicians, by nurses in their clinical systems. And what we know is that charting happens in a lot of different ways. Sometimes it's free text, sometimes it's standardized, but it's not necessarily the same standard as the person across the street. And the fact that we have a lot of variability in what a person's individual chart might look like. And so that sort of foundational data becomes really important. Now, as I mentioned, our early work was about standardizing things like labs, medications, diagnostic imaging, bringing structure to those, bringing shareability to those. But when we look inside GP offices, into record keeping in GP offices, we see nowhere near enough standardization to do the kind of things that we would love to be able to do as a health system. The pandemic unveiled a lot of challenges, right? Like, we would want to know as health system planners, how many people walked into a GP's office yesterday with a fever and a cough. That's the kind of information that, if information was effectively coded in GP systems, could theoretically be available at a provincial level report. We're a long way away from that. And so what I would suggest is getting right back down into the weeds of workflows around collection of data. How we code data is a really important starting place for that. Not the most exciting starting place, but an absolutely critical one for us to address.
We do have 3 minutes, and I just wanted to ask another question, since we don't have any other at the moment, and because I know we have another event happening right after this. So I do want to just share with people, if they want to go to the Twitter event, please check out the AgeWell Twitter. Maybe just before we go, can you share some of the challenges about what does this mean about moving to, what are the benefits, like even just one especially for older adults with complex health needs? What is the benefits of just going to these specific digital health practices and solutions that are going to really support that connection between the clinician and the older adult with complex health needs?
Yeah. So maybe I'll put an emphasis on access to information, and a recognition that when patients can access their information, it opens up a world of possibility. And one of those things is being able to share information amongst caregivers. So recognizing that in many cases, people are receiving support in their care from a family member. That family member can't always be in the room at that point in time. And so what digital health solutions do is create significant opportunities for that collaboration, to be able to see what happened in that visit, see results of that visit. Often it's being able to dial in somebody who might be remote and engage them in that visit. So to me, that kind of engagement opens up massive opportunities for better coordination of care for seniors. And we're really excited about that.
Thank you so much. This was so enlightening. As someone that has parents that don't live in the same province, some people I'm sure don't have parents that live in the same country. This is such insightful things to learn about, and so much to think about where we can go with these kind of discussions and solutions. So I do want to thank everyone for coming today. I do want to thank Simon for sharing just the powerful work you're doing. Thank you so much for all the work you and your team are doing. It's so important. And just the data, you know what? You got me hooked. Data, who knew? So I do want to thank everyone for being with us today. I have shared our Twitter and just in our chat for the event that's right after this one. And so thank you so much. If you're at home, give an applause for Simon. And we wish you all a great Thursday, and we look forward to another webinar with Simon again. So awesome.
Thank you so much.
You so much.
It was a pleasure.
Thank you.
Take care. Bye-bye.
Bye.